Millions of school children are being taught that their true identity is found in their gender identity, rather than in their God-given biological sex, and that they can choose from any number of different gender identities. Many of these children are uncomfortable with their bodies. They're disturbed by their sexual organs and deceived by harmful ideologies. They seek treatment to block their natural development through puberty-blocking injections and then cross-sex hormones, often ultimately leading to surgery to either castrate themselves or have healthy breasts removed in the hope of transforming their bodies into the opposite sex. It's believed that hundreds, if not thousands, of teenagers in Australia are engaging in this medical pathway. And as this ideology continues to take hold, that number can be expected to continue to rise. But this supposed reversible pathway and its medication is incredibly dangerous and leads to lifelong consequences. Where previously, medical interventions to modify sex traits were used with caution, particularly when it came to the treatment of children, from 2011, a new model of care was introduced by the Worldwide Professional Association of Transgender Health, or WPATH, which is widely regarded as the leading global authority on transgender health. WPATH has pushed for an approach that emphasizes the importance of affirming the patient's self-perceived gender identity, including through both social and medical interventions. WPATH's standards of care have influenced clinicians all over the world, including those affiliated with the Australian Professional Association for Transgender Health, or AUSPATH. In 2018, the Royal Melbourne Children's Hospital published guidelines for the treatment of trans and gender diverse children that steer paediatric gender clinics throughout Australia towards social and medical gender affirmation. These, together with the WPATH standards of care, have been quoted as authoritative in key family court decisions that reduced or removed legal impediments to Australian children receiving medical sex trait modification interventions. But recently, investigative journalist Michael Schellenberger revealed the WPATH files, which details conversations between clinicians and activists affiliated with WPATH. Among the many ethical problems revealed in these conversations is the fact that clinicians were aware of the harms produced by these treatments. For example, of the carcinogenic nature of testosterone. And among other findings, they were aware of patients who appear to have passed away as a result of the recommended hormone treatment. The spotlight was already on WPATH, even before the UK's CAS review published its final report on April 11, 2024, which included a scathing assessment of medical gender affirmation. The CAS review should be the final nail in the coffin for the use of puberty blockers on children all over the world, but for some reason, parliaments across Australia are not listening. There is a lot Australia could learn from looking at the experience of the UK. Until 2022, when it was closed in response to findings from the CAS review, the Tavistock Clinic had been the UK's only gender clinic. The Tavistock's methods were put under the public spotlight in 2020 when former patient Kira Bell, who later came to regret her transition, brought a case before the UK Divisional Court where several claims were made against the clinic, including the absence of procedural safeguards and the inadequacy and questionable accuracy of the information provided. The case revealed the Tavistock Clinic's lack of regulatory oversight, which prompted the UK's National Health Service, or NHS, to appoint Hilary Cass, who was a former president of the Royal College of Physicians, to conduct a thorough review of the clinical services provided to children and young people. Cass's task, including identifying and filling the significant gaps in the research and evidence base surrounding gender-affirming care. The interim report of the CAS review, published in March 2022, resulted in the closure of the Tavistock Clinic and the publication of new NHS interim standards of care, which recognise the experimental nature of the treatments and the major gaps in the research base underpinning them. Fast forward, and in March 2024, following significant concerns regarding the harms arising from this experimental treatment, the UK banned puberty blockers for children 16 and under. Only 1 month following this decision, the final report of the CAS review exposed, in her own words, the shaky foundations upon which gender-affirming care had been built upon. The UK is not the first country to reject medical gender affirmation as advocated by WPATH for children. Sweden, Finland, France, and 22 US states, in fact, wherever objective independent assessment of the evidence has been conducted, authorities have found good cause to back away from the so-called affirmative model of care. It is past time that Australia followed suit. The claims of the advocates such as OzPath and affiliated clinics are looking increasingly thin. We know, for example, that puberty blockers are not safe and entirely reversible as claimed. The NHS stopped claiming this in 2020 in response to the evidence presented in the Bell vs Tavistock case. The problem is that Australian gender clinics have not been required to answer the tough questions. Since June 2023, no less than 7 MPs have called for inquiries into this matter in various jurisdictions across Australia. All these inquiries have been politically defeated. What will it take before Australian authorities are willing to shine the spotlight on gender clinics in Australia in the same way that the UK has on the Tavistock Gender Clinic? How many more Australian children will be prescribed dangerous, irreversibly damaging gender medicine before politicians, lawmakers, and medical institutions decide to act? We need an independent inquiry in this nation, and we need it now, so that no more children will fall victim to dangerous and harmful ideology.